Okay, here we go. Close your eyes. Cranial nerve number 1, nose. Number 2, eyes. Number 3, touch your eyebrows. Number 4, look down. Number 5, draw that 5 across your face. Number 6, look sideways, left, right, left, right. Number 7, draw your face. Number 8, your ears. Number 9, it's in your mouth. Number 10, in your mouth again. Number 11, spinal accessory, move those shoulders in rhythm. And number 12, in your mouth again. Excellent job. Okay, so which cranial nerves do you really need to know? You do not need to know all the cranial nerves. Here are the ones you need to know. Cranial nerve number 2 and cranial nerve number 3. Your optic and oculomotor. Cranial nerve number 2 and 3 is your PERLA. What is PERLA? Well, PERLA stands for Pupils Equal Round React to Light and Accommodation. A patient whose pupils are equal, round, and reactive to light and accommodation has intact cranial nerves 2 and 3. The next one you need to know is cranial nerve number 5. What is cranial nerve number 5's name? Trigeminal nerve. The disease of cranial nerve number 5 is trigeminal neuralgia. I repeat, trigeminal neuralgia, or tic douloureux. Neuralgia actually means pain coming from a nerve. Look at the picture. The trigeminal nerve has 3 branches, which take sensations of touch and pain to the brain from your face, teeth, and mouth. Let's talk about cranial nerve 7. What is the disease of the facial nerve? Bell's palsy. Now this is the scary one, because what do you think the patient thinks when one side of their face droops? They're thinking, oh my word, I think I'm having a stroke. Yes, symptoms of Bell's palsy progress fairly rapidly and strongly resemble the symptoms of certain types of stroke. The symptoms of Bell's palsy include sudden weakness or paralysis on one side of your face that causes it to droop. Now this is the main symptom. Remember, with some of these patients, they are unable to close their eye. So remember, a nursing intervention is to protect that eye. They may have drooling, excessive tearing, or even dry eye, loss of ability to taste, pain in or behind the ear, numbness in the affected side of the face, and increased sensitivity to sound. Prednisone and acyclovir are medications used to treat Bell's palsy. Cranial nerve number 8. This is your auditory nerve, or vestibulocochlear nerve. I like to say auditory nerve. It's so much easier. The auditory nerve is responsible for the sense of hearing, and it is also pertinent to balance. Problems with this nerve may result in deafness, ringing or noise in the ears called tinnitus, vertigo, dizziness, and some patients may even vomit. Ototoxicity is the problem we have with cranial nerve number 8. This could be caused by medication like furosemide, that's Lasix, aminoglycosides, they end in myosin, and aspirin. Cranial nerve number 10. This is the vagus nerve. What happens when we stimulate the vagus nerve? It slows the heart rate. There are different types of vagal maneuvers that can be used to slow a person's heart rate. The Valsalva maneuver, which is bearing down. we ask the patient to bear down as if they were having a bowel movement. In effect, the patient is expiring against a closed glottis. Another way is to tell the patient to blow through an occluded straw for several seconds. Both of these maneuvers increase intrathoracic pressure and stimulate the vagus nerve.